Many people are certified in standard first aid. However, sometimes specific cold weather first aid is not included in that training. There are many things that need to be taken into consideration when treating an injury during colder temperatures. When the body is exposed to cold temperatures, our blood vessels constrict, causing us to lose body heat over time. As our body temperatures drop, tissues are easily damaged or even destroyed. In colder weather, wounds bleed easily because the low temperature is keeping the blood from clotting. An increase in bleeding causes the likelihood of shock. A properly stocked first aid kit is important no matter where you are going or what time of year. Things you should always have in your kit are bandages and gauzes of various sizes, antibacterial creams and ointments, sterile wipes and rinse, pain medicines such as aspirin for heart attacks, tweezers, scissors, a small knife with casing, band-aids, splinting materials, and adhesive tape. And then there's some extras you may want to consider: a hand and feet warming pads, and a sterile container in case soaking is necessary. Another thing to remember when doing first aid and attending to a victim is yourself. It's important to protect yourself from heat loss while treating that person. If you become cold or injured yourself, that would make 2 victims instead of 1. Make sure you keep your body warm while treating. It's tempting to have your hands exposed while treating that person to do fine motor tasks, but this could create an open opportunity for frostbite and other cold temperatures injuries.
Our body loses heat in various ways. The first one is conduction, which is a direct contact between a warm body and a cold surface, such as sitting on snow. To help prevent this, you can use a foam pad, a book bag, a tarp, or any other material that you have packed for your trip. The second one is convection, which is heat loss due to moving air or water. You can set up a tarp as a windbreaker to reduce the amount of convection. The third one is radiation. Just like a stove, our body constantly radiates heat. Clothing is a very important part of this by wearing a hat, gloves, and warm footwear to reduce the amount of radiation that our body gives off. The fourth one is evaporation, which is heat loss by the evaporation of water through our skin, such as sweating. To help prevent evaporation, you can dress in layers and either remove or add the layers to control your body temperature so you don't oversweat. The fifth way that our body loses heat is due to respiration, is when we inhale cold and dry air and exhale it as moist and warm. When dealing with individuals who are injured or hypothermic, you want to remember to shelter them and prevent further heat loss. You can do this by sheltering the person by adding a windbreaker, or if there are several individuals around, you can line up and also make a windbreaker. Another one is to put in some form of insulation under the individual, such as a tarp, a foam pad, a blanket, anything to reduce further heat loss. Another way is to quickly cover the victim's areas that lose heat the fastest, such as their head, their extremities, such as their toes and fingers, their groin area, as well as their armpits. Another way is to really keep the individual comfortable, since you are trying to use first aid. Frostbite is the freezing of tissue and can be a very serious thing to experience. There are several things that you can do to treat a victim with frostbite. You first want to assess the area. If the area has experienced frostbite, the skin will feel rigid and appear white in color. In some cases, the skin appears black due to damaged or destroyed tissue. By being very gentle, since the area is very fragile and irritated, you first want to rewarm the area, such as placing the extremities in lukewarm water. Ensure that it is not too hot, since this can burn the skin and cause further problems to the area. After removing the area from the heat, the victim will feel some pain due to the tissue becoming thawed. You want to then wrap the area with sterile bandages and elevate the area. Lastly, you want to make sure the victim stays hydrated, and ibuprofen can also be used to help with the pain and preserve tissue.
One of the dangers of winter outdoor activities and camping is hypothermia. Hypothermia can occur when the body drops below 37 degrees Celsius. There are many environmental factors that contribute to hypothermia, such as wet clothing, temperature, and the wind. There are different severities of hypothermia, so there's mild hypothermia and severe hypothermia. Mild hypothermia signs and symptoms include uncontrollable shivering and a change in mental status. A way to easily recognize if someone is experiencing mild hypothermia is by the Umbly family, which are stumbly, fumbly, mumbly, and grumbly. Severe hypothermia, the person would have no shivering and they'd probably be in an unconscious state of mind. In this video, we're going to demonstrate how to do a hypothermia or burrito wrap in a hypothermic situation. In preparation for the hypothermia wrap, you should make sure that your victim is out of their wet clothes and transferred into dry clothes. Here you can see the person is still in their wet clothes and suffering from the Umbly family symptoms. Now that the person is changed into dry clothes, we can move on to the next step of the hypothermia wrap. Hello everybody, we're at beautiful Pippi Park here today. We're going to demonstrate how to do a hypothermia wrap. We have our beautiful Quincy set up here, our campsite. You can see the wilderness here in the background. So first, for a hypothermia wrap, you're going to need different kinds of equipment. We're going to want a sled. We're going to want some rope. We're going to want a tarp. We're going to want 3 sleeping bags, hopefully, and a foam pad.
The first step to a hypothermia wrap is to spread out a tarp. You want to have a corner on the top for the individual's head and a corner on the bottom by their feet. The second step to a hypothermia wrap is to lay down a foam pad. The third step to a hypothermia wrap is to lay a sleeping bag on top of a foam pad. This will act as a form of insulation.
The second sleeping bag is for the victim themselves. We also have a third sleeping bag to go on top of the victim for an insulation layer on top. If the equipment is available to you, it's a good idea to fill water bottles with hot water and place them in the sleeping bag with the victim. We want to put them near the arteries that will help warm the body the fastest: the feet, the groin area, and under the armpits.
This is the placement of the third sleeping bag. We want to make sure you don't cover up her face so we can always monitor her condition.
It's also a good idea to put a hat on the victim so that they don't lose any additional heat from their head.
The next step is to start folding the tarp. You first fold by your feet. The second step is to fold one side. And the last step is to fold the third side over.
You can use anything to really wrap them into it. If you don't have any rope, you can use duct tape like we have here to secure them into the tarp. If you'd like to transport the victim, you can use a slide like this one. It comes with loops so that you can securely tie them into the slide. If you do transport them out of an area, make sure that you avoid rough handling.
Hypothermia. Hypothermia occurs when the body drops below 37 degrees Celsius. Ready?
The third step.
You're supposed to be saying something.
The second step to hypothermia wrap is to lay down a foam pad.
Are you good? Are you going?
Yes.
What the hell? The third step to a hypothermia wrap is to lay down the sleeping pad on top of the foam pad. This will act. What?
Wait, you can stop.
If you would like to transport your victim, you can use a sled like this one. You can tie them in with rope, and if your slide has loops, you can use that to something, I don't know.
If you decide that you need to
Tie the queen.